to Knowledge on the Go, the podcast brought to you by the PI Programs team here at Vizient. Today we're exploring an initiative that's helping reimagine ambulatory care, Smart Outreach for Better Health, developed by a team at Northwestern Medicine. This project takes what many health systems struggle with and uses automation to make it all more efficient. Joining me to share this work is Dharamesh Patel, Program Manager for Quality and Patient Safety at Northwestern Medicine. I'm Myesha Williams, one of this year's Performance Improvement Fellows and your host for today's episode. Dharamesh, welcome to the podcast. It's great to have you.
Thank you for having me. It's an honor to be here.
I want to start off with creating a foundation for our listeners. If you had to explain Smart Outreach for Better Health to a patient who isn't familiar with the inner workings of the healthcare system, how would you explain this initiative?
When you have an opportunity to reach out to patients equally with the same message that you would send to one practice patient populations, that's what we're doing. We're using a different technology, using automations to identify our patient populations and sending out a message to the same patient populations who are identified through this logical criteria. In this process, we're selecting a message that is based on a patient's preferred language. Instead of having a generic message, we're sending out a more targeted message that is clinically relevant and easier to understand. We've co-designed these messages with our physician leaders and our communications team as well. They're not only clinically relevant, they're easier to understand by our patients.
You mentioned collaboration, and this seems like a heavy lift. Were there any moving parts, data, workflows, and patient communication? How did you pull it all off?
This was a large project. This idea came from one afternoon when we were having a discussion with one of our EMR analysts and one of our quality leader, Alex Herzog and Michael Schechter. We were working on a separate outreach project. And as we were designing that outreach, our EMR analyst mentioned there is a workflow in which we can send automated messages. And at this time, the light bulb went in my head that if we can do this for smaller patient populations, maybe we can do this for larger patient populations with a little bit more complexity. I asked our analyst, is this doable at a larger scale for different patient populations? He indicated that, let me just do some testing, but I don't see why not. This is a normal process in our organizations where we start with drafting a charter, identifying appropriate stakeholders, and then we put it in front of our various stakeholders to make sure that what we're thinking aligns with what our organizations considers to be a priority for that fiscal year.
From my experience in some of the organizations that I've worked with, the outreach projects have tended to stall because teams underestimate the coordination that's needed between IT and frontline staff. How do you navigate those handoffs of communication and face those challenges?
We're taking a systems approach to these outreach. As we started thinking and identifying patient populations, we brought in our physician leaders who are practicing medicine or primary care specialty on a daily basis. So they do understand how this preventative screening and chronic care management outreach ought to happen. We took it to bigger and bigger quality committee structures and other meetings where you do have operations leaders come and join those meetings and provide feedback. So that's how we continue to gather feedback onto our ideas. And eventually, many of these groups gave us a decent perspective of how this could work in our health system.
Once you got that feedback and everything and things were up and running, how did the automation actually work? What were the types of messages that were sent and how were the patients identified for outreach? I know you said that there was selected outreach and you guys were very purposeful in who you were targeting. So I'd love to know a little bit more about that.
Currently, we're active at the multi-targeted stool DNA. We are also sending out a message to patients with a hemoglobin A1C that are overdue, diabetes eye exams that are overdue, patients who are hypertensive and haven't seen us in last 12 months and also are not planning to see us in the next 12 months. So this is a kind of unique patient population. And patients who are coming to our practices for influenza vaccinations or coming to our practice in general, and we have an opportunity to provide influenza vaccine. So the way it works is that patients are selected based on the predefined criteria that we design. System chooses a predetermined message that's approved and co-designed by our physician leaders and communications team. And then system looks at patient's preferred language and sends that message that's appropriate for patients on a certain day of the week. If I take an example of a multi-targeted stool DNA test, which is one of the colorectal cancer screening tests, we're looking at patients who have active order. It's been 90 days. They haven't done anything about that. They're also overdue on a health maintenance topic for colorectal cancer screening. They're 45 and older and has EMR portal active, and they're not on a hospice registry. So we're making sure these patients are appropriate to receive the message. And then system will deliver this message on Saturday. And this is by design because we know that for these kind of tests, patients have to have a test around them and they're usually home during weekends. So we wanted to make sure they receive this message during the weekend and not any other days. They are appropriate and clinically relevant, and they are easier to understand because they are drafted by our communications team who often focuses on making sure what we say to our patient is appropriate and easier to understand.
That really touches on some of the values that we have here at Vizient to be purposeful. You highlighted that and hit it right on the nose. What was a particular patient story or moment that really brought this project to life for your team?
I don't have a patient story, but we do take these initiatives. We have these groups in our system called Patient Family Advisory Councils, where we take our projects or ideas in front of our group of patients who then gives us an idea or advice, would this be an appropriate thing to do or not? And as we took this project, patients appreciated that. They would get one more reminders that was discussed during their visit with the primary care physicians. It was received well by our patients.
That's always good to hear positive feedback from patients. Tell us a little bit more about the result and if you could share some quantitative perspective.
In terms of results, this is for multi-targeted stool DNA. These are the patients with active order. Approximately 8,000 patients received these appropriate messages. And of those, we saw about 13% of them completing their test after receiving a message, which if you think about who these patient population is, certainly is remarkable. And we've seen that with our other generic outreach that we've seen about 10% engagement with those messages. So about 12% or 13% is certainly really good. What surprised me was related to hemoglobin A1C, that population was about 6,000. These are static numbers, and perhaps now we have more patients in our results. But that patient population, about 25% of those patients actually completed a test following the message reminding them to complete their hemoglobin A1C. And these are only patients who have diabetes, have outstanding hemoglobin A1C order. It's been 30 or greater days, and they have not completed their test. We went into this thinking that this may be easy, but we had to identify and answer a few questions ourselves. How are we going to handle the initial patient population? And on oncoming cadence, are you planning to remind patients at 30 days and anytime afterwards, or 90 days? And if you are planning to do this, are you planning to send messages on a daily basis? What we did, instead of sending messages to patients on a daily basis who become newly eligible, we were sending it once a week. So we will compile a list of patients per week and send out a message once a week. We also use loss aversion, and this is kind of a technique that we borrowed from behavioral science. When it was 300 days post an active order, we send a reminder indicating a last reminder, your order is basically about to expire. Please get this particular exam done.
Remind me how long it's been since this has been fully implemented.
It's been a little over a year now since it's been implemented.
What's one thing you've learned? What were some of the biggest barriers you faced, and how did you overcome those?
Having EMR analysts who's willing to think through these complex problems, because it's selecting when do you want to outreach, how often, what day of the week do you think you should be delivering messages could be cumbersome. And you do want to have somebody who's willing to work through all of these challenges and design a complex algorithm. Once you put it in automation, it's going to be there and it's going to do its job and make sure that it's selecting appropriate patient and sending out appropriate message to right patient population.
If you had a chance to do it all over again, there might be something that you'd do differently.
One thing I would do is give ourselves a little bit more time, because going into this, We were thinking it is going to be simple. It is going to be, we're just going to send out a message to patients with an active order, and that will be just that. But as you start working through these challenges, you realize you also have to make sure the patients are overdue. Every health system and EMR may define that differently. All of those things added a bit more complexity than we were anticipating. And so we hadn't allotted needed time, which we needed to later on adjust and bring everybody's expectation in line with that.
One thing I've really noticed in my fellowship, our performance improvement teams are trying to lean into ambulatory care and trying to find ways to improve access, coordination, and then outcomes beyond the inpatient setting. I actually had the opportunity to work on a collaborative that was focused on improving specialty care access. One of the biggest takeaways for me from this project was how effective technology can be in helping close those care gaps. From this, I'm wondering, after seeing the success of this project, if you and your team have started thinking about the future and other ways to use technology to address some of the fragmentation and patient engagement challenges that are plaguing ambulatory care right now.
These outreach results that we're speaking today are using the standard tools that are available in our EMR. At the time, we did not use any dedicated outreach module. Since then, we've realized the potential for that, and we bought the dedicated module that allows us to do outreach to these patients. These modules are designed with the outreach in mind. Therefore, it gives you a lot more control and tools, and also ability to quantify your success ahead of time. What we were learning on the go, these modules come with a predetermined question that allow you to answer some of those questions. There may be future opportunities for us to be able to leverage AI. I don't have any specifics, but that is something we're thinking right now.
Do you think that those modules being simplistic for our patients is probably the best way to get them engaged? Having something more complex or difficult for patients to understand is what may be keeping them from engaging as much as we want them to, or one of the reasons they shy away from follow-ups.
There is a tremendous demand on our cognitive capacity. There's so many messages, so many things that we have to focus on. In some ways, these social media platforms have done a remarkable job of engaging us. And in our health system, I don't think we've done that great of a job. And we have to think about that. For me as a patient to engage with something, I'd have to receive a right message at the right time, and that message has to be actionable. And using these outreach module, we're just launching breast cancer screening outreach to patients who have active screening order, and giving them an ability to schedule right from that message. We still don't have the results for that, but that's our next phase of just changing these outreach a little bit and making it a little bit more actionable and moving into these new platform that allows us to do an outreach specifically.
I've been fortunate enough to be in spaces hearing leaders talk a lot about how, in terms of chronic care, which is a population group, this initiative you focused on people with chronic diseases, you see them very engaged because they kind of have to be. Whereas on the other side, you see healthier patients not as engaged. You're not going to the doctor for that many checkups or follow-ups or appointments, tailoring your initiative to specific groups and making sure that, yes, we want to engage people who have chronic diseases, but we also want to make sure we're focusing on people who may be healthy. If we didn't talk about one specific aspect of this work, what do you think the audience would really be missing out on?
Without this discussion, people wouldn't hear how system-wide automation makes outreach easier, helps patients stay on track, and it boasts our quality of care as well.
Dharmesh, thank you so much for joining me today and sharing Northwestern Medicine's journey with smart outreach for better health. Thank you to our listeners for tuning in to Knowledge on the Go.
Thank you so much. Thank you for having me.
Please join us for more Knowledge on the Go. Subscribe today, like us, and send us your comments at picollaboratives@vizientinc.com. From Vizient's PI program team, I'm Myesha Williams. Thank you.